who would be available to assist and make sure if we needed other staff, could assign other staff.
Okay. So at this time then, on this day of June 25th, the team you assembled, and correct me if I'm wrong, it entailed you, 4 residents, at least 2 techs, a respiratory therapist, a scribe nurse, 2 circulating nurses, a pharmacist, a charge nurse, and a social worker. Does that sound accurate?
That would be the team that started, yes.
And when you say the team that started, what do you mean by that?
There were additional members, doctors who came as consulted by me, and because this was Mr. Jackson, there became security and privacy issues. There were additional administrative people who were involved.
But as far as medical, the initial recounting I gave, that's 14 people. Does that sound accurate?
Yes.
And then other doctors were consulted as needed?
Yes.
So once you had the team together and everyone knows their duties and responsibilities, where were you when you first saw, Mr. Jackson being brought in?
I was right outside the trauma bay door.
Okay. And is that, the trauma bay door would be then what you previously identified to the right of People's 50, is that accurate?
That would be accurate.
Okay, so were you in this hallway here?
Yes.
And were you looking outward through these glass doors?
Yes.
Okay. And as Mr. Jackson was brought in to the hospital, did you meet someone who identified himself as his personal doctor?
I believe, and it may have been my charge nurse, someone was outside and met the ambulance and sort of indicated this is the physician. It
Okay.
may have been the paramedics, may have been one of my nurses.
Okay.
Yes.
But brought the physician to you essentially?
Yes.
Okay. And did you speak to the personal physician at that time?
Yes, I did.
Okay. Do you see that person in court here today?
Yes, I do.
Could you identify that individual, please?
Sitting second of left.
Maybe describe what he's wearing?
A dark suit and a light green tie.
Pointing to and identifying Dr. Murray, the defendant.
Thank you, Your Honor.
Thank you.
And as the emergency room doctor, and knowing that a personal physician was present at the house and was present at UCLA, what is your main goal at that point as far as getting information from the personal physician?
So my main goal is to manage the care of Mr. Jackson. And to do that, I took an initial brief history to try and get as much information as possible while the paramedics were transporting the patient from their gurney to our gurney, and the patient was being placed on our equipment.
Okay. And did you, then while they're transferring Mr. Jackson into the trauma room and transferring from one gurney to your work area, were you speaking to Dr. Murray?
Yes.
What did you ask him?
I asked what happened.
What did he tell you?
I was told that Mr. Jackson had been working very long hours, and Dr. Murray thought he had been dehydrated, and that he had given the patient an IV and administered 2 milligrams of lorazepam.
Okay.
And then later had given him another 2 milligrams of lorazepam and observed the patient to arrest.
Okay, let me stop you. Did you ask Dr. Murray if the patient had been ill at all?
I asked several questions. I'm not sure which questions I asked in the initial brief contact because I then was going to turn to the patient. I asked several questions about the history, sort of in between managing the care of Mr. Jackson.
Was it represented to you by Conrad Murray that Michael Jackson had not been ill?
He reported he had not been ill.
Okay. But that he'd been working hard and he was dehydrated?
Yes.
And did you specifically ask about any medications Michael Jackson had been given?
Yes.
And specifically in response to that question, what were you told?
I was told he was given lorazepam through an IV and then was given a second dose.
Okay. And so that was, when you asked Conrad Murray what medications had been given, you were told 2 milligrams of lorazepam by IV.
Yes.
And then subsequently another 2 milligrams of lorazepam.
Correct.
Is that accurate?
Yes.
Okay. Were you ever told at any point in time about any medications by Conrad Murray other than the lorazepam?
No.
Now, you'd indicated that he also told you, in addition to the total of 4 milligrams of lorazepam, I think you indicated that he said he witnessed the arrest?
Yes.
What does a witnessed arrest mean?
It is an observed arrest. The critical event happens while you are with the patient.
Okay. And when you say the critical event happens when you're with the patient, what is the critical event when you're referring to a witnessed arrest?
The patient stops breathing and their heart stops.
Okay. And to medical doctors and in people in the field, it means you were literally on site and you saw it happen?
Yes.
Okay. Were there reoccurring conversations with Conrad Murray as you're treating Mr. Jackson?
Yes.
Okay. At any time during your attempts to save Mr. Jackson, did Conrad Murray present you with any medical records or any documentation of any vital signs or any medical documentation whatsoever?
No.
And in your subsequent conversations then with Conrad Murray as you're working on the patient, did you learn that there had been mention of Valium and Flomax?
I asked what the patient's other medications are. Those were the two medications were reported that or his routine medications.
Okay, so when you were inquiring about the lorazepam, that was an inquiry about what he had been given, I assume, prior to the witnessed arrest?
I asked what had happened and was told he was given lorazepam and that observed the arrest. I
Okay.
didn't know what to expect or wasn't specifically asking for what medications were given because I did not know what the circumstances of the arrest were.
Okay, so when you simply asked what happened and he responded by telling you about the lorazepam?
Yes.
Okay. And regarding the Valium and Flomax, that was in response to a question about what is he regularly taking?
Yes.
Okay. And what is Valium?
It's a benzodiazepine, a sedative, anxiolytic.
A sedative what?
It's a sedative and an anxiolytic.
Okay.
I can't make that out.
Anxiolytic, anti-anxiety.
Thank you.
Anti-anxiety medication?
Yes.
Okay. And Flomax is what?
It's a medication that sort of relaxes urinary smooth muscle. So generally given to maybe an individual with a large prostate who is frequently urinating. It can also be used in individuals who have a kidney stone.
Okay. Then other than when you said what happened, you mentioned lorazepam, and then the regular medications being Valium and Flomax, were any other medications mentioned by Dr. Murray?
No.
At any time during your care for Mr. Jackson?
No.
Did you make an inquiry about any past medical history?
Yes.
What did you ask?
I asked what other medical problems Mr. Jackson had, if he had any cardiac history, if he had ever had a history of a blood clot, if he had any history of drug use.
And in response to that question regarding medical history, what were you told?
No to all of them.
Did you ask about any seizure history?
When I was attempting to determine what had happened with the arrest, I went back and asked about further details and asked if he witnessed seizure activity when he witnessed the arrest, if the patient had complained of chest pain associated with the arrest, and I was told no.
Okay. Did you make any inquiries about whether or not the patient, Michael Jackson, had been subject to any physical trauma, or did you make physical observations yourself as to determine if there's any physical trauma?
That's compound.
Okay.
Re-ask.
Let me ask you just your own observations. Did you note any physical trauma that would explain Mr. Jackson's condition?
No, there were no physical signs of trauma.
Okay. Now, from your own personal observations, what was Mr. Jackson's condition upon arrival at UCLA?
His condition was as described by the paramedics. he was clinically dead. He did not have a pulse. The rhythm on the cardiac monitor was what I would call as wide, slow, an agonal heart rhythm,
What does that mean?
sort of a sign of a dying heart.
Okay.
His pupils were fixed and dilated.
When you say a sign of a dying heart, but you also said he was clinically dead, can you
Yes.
explain that?
The heart muscle is contractile, and it also has its own intrinsic electrical activity. And so the heart may still produce a signal, and we call it pulseless electrical activity, but clinically there is no pulse or sign of life.
Okay. So he was clinically dead. I believe you said his eyes were fixed and dilated.
Yes.
Was there any spontaneous respiration?
No.
And you said the rhythm was slow and wide, and I believe you said with no palpable pulses?
No palpable pulses.
And what does that mean?
That means when we attempted to determine if we could feel a pulse, suggesting his heart was beating and generating any sort of blood pressure or perfusion, there was none.
Okay. Now, despite this condition, in your opinion, of Michael Jackson being clinically dead upon arrival, were attempts made to revive Mr. Jackson?
Yes.
And as the emergency room physician, did you supervise and physically handle most of those attempts?
Yes.
Okay. And can you describe that, please, for us, exactly what transpired?
So when he first arrived, we confirmed that the endotracheal tube, the breathing tube, was in the correct place.
It was in the correct place?
Yes, it was.
Okay.
We confirmed with bagging and ventilating that the chest was rising, that we had breath sounds such that we knew we were breathing for the patient. I had confirmed there was no pulse. We instituted CPR. And then we proceeded to give medications in an attempt to resuscitate Mr. Jackson.
Okay. So the endotracheal tube, how were you able to confirm that that was correctly placed?
By direct visualization.
Okay, and what is it that you would see?
You would put a blade, it's called a laryngoscope blade, and you directly look to see that the endotracheal tube is actually going through the vocal cords into the trachea.
Okay, and that's what you were able to confirm?
Yes.
Is that yes?
That's correct.
Okay. And did you utilize an ultrasound at that point?
We did early on use an ultrasound to examine the heart.
Okay. And can you explain that device and what the purpose of that was?
In the emergency department, we will frequently perform limited ultrasound. I guess the most common reason people think of an ultrasound is when you're doing sort of prenatal care and looking at a baby. It is a device that is used by cardiologists.
I'm having a little trouble hearing. Could you repeat that?
Yeah, I think most people would consider an ultrasound as what we look at when we're looking at a baby. It's different than an X-ray. It gives us information about the chambers of the heart. Cardiologists would perform an echo. They do echo, which is that type of ultrasound. It's much more detailed than the limited ultrasound that we perform in the emergency department.
Okay. Looking at what was marked People's 47, may we dim the lights, please, Your Honor?
Please.
Doctor, is this the actual trauma bay where you worked on Michael Jackson?
Yes.
I'm going to hand you this pointer. Or I'm sorry, you have one there. Could you use the pointer? And if you could just...
How do I, turn it on? Is it on? Oh, there we go, okay.
Let's start to the leftmost part of the photograph. This appears to be a computer screen. And is that a keyboard?
That is a computer screen.
Okay, and what is that?
That is one of our computers that has, we have an electronic tracking system and computerized order entry, and the system is loaded on that computer. In addition, it has web access, and so that we can access medical records while we're in the resuscitation suite if we need to.
Okay. And then let me switch from People's 47 to People's 48.